Welcome to today's deep dive. We're going to be looking into some pretty fascinating research on midline shift in dogs with structural brain disease.
Yeah, it's something that can really impact a dog's prognosis, and this study sheds light on how important it is to understand, all of its implications.
So we've got a research article here, and it's really taking a deep dive into the connection between midline shift that we see on MRI scans and survival time in dogs that have various brain conditions.
So the researchers looked back at data from 77 dogs that were treated at a veterinary hospital.
Okay.
And they looked at a lot of factors like breed, age and sex, clinical signs, the specific diagnosis, whether it was a tumor or inflammatory disease or something else.
Right.
And very importantly, whether or not there was midline shift present on the MRI.
And so what did their findings reveal?
The main thing that came out of this was a strong correlation between midline shift and shorter survival times in dogs. And this was true no matter what the underlying brain disease was.
So it sounds like if a dog's MRI showed midline shift, then it was a pretty strong indicator that their prognosis wasn't as good.
Exactly. Dogs with midline shift had a median survival time of just 34.5 days.
Wow.
And that's compared to dogs without it who had a median survival time of 241 days.
Yeah, that's a huge difference.
Yeah, it is. So they did some pretty robust statistical analysis to make sure that this wasn't just a chance observation. They used something called the Kaplan-Meier method and Cox regression analysis, which helps account for a lot of different factors.
So basically looking at that, we can be pretty confident that this link between midline shift and a shorter survival time is a real thing.
Yes, the statistics definitely back that up.
So what does this mean for vets and for dog owners,
Yeah.
in terms of making decisions about diagnosis and treatment?
Well, one of the big takeaways here is the importance of MRI as a diagnostic tool. Being able to see and assess midline shift on an MRI can give vets really valuable insights into a dog's prognosis and help guide treatment strategies.
So this study gives vets more evidence to consider when they're making decisions about a dog's care.
Absolutely. It adds another layer of information to the whole diagnostic process.
And what I find particularly interesting is that this connection between midline shift and a shorter survival time, it was seen across all different types of brain diseases.
That's right. So it didn't matter if it was neoplasia or inflammation or some other condition. If there was midline shift present, it was a significant factor in how things were going to go.
So it really seems like recognizing midline shift early on is key.
Yeah, early detection could be really critical in these cases, and that's where advanced imaging like MRI is so important.
Right.
It lets vets get a detailed look at the brain and see even subtle shifts that they might not be able to see otherwise.
So if a vet thinks that a dog might have a brain condition, they should really consider an MRI as soon as possible.
Yeah, that would be a very good idea. The sooner they can identify midline shift, the sooner they can make informed decisions about treatment and management.
That is the burning question. How can we take what we've learned here and use it to actually improve outcomes for dogs with this issue? I mean, this really shows that we need more research in this area, right?
Yeah, it definitely does. Future studies could look into whether there are any interventions that could be used to target midline shift directly.
Okay.
Things like specific medications or therapies, and see if that can improve things for these dogs.
It's a really complex area, but this research provides a good starting point for future work.
Definitely. And for anyone listening who might have a dog that's been diagnosed with a brain condition, it's really important to talk to your vet about the possibility of midline shift.
Yeah, and what it could mean for your dog.
Exactly.
Knowledge is power, especially when it comes to our dog's health.
It's all about, being informed and really understanding these conditions.
So this study looked at 77 dogs, and I'm wondering if that's really enough to give us a good idea, of the overall picture.
Yeah, that's a good point. I mean, a larger sample size would definitely give us more statistical power. But even with this number, the results were statistically significant.
Okay.
So even though more research is always a good thing, I think this study gives us some pretty compelling evidence.
Yeah, for sure. So the study also mentioned that a lot of the diagnoses were presumptive, meaning they didn't actually have tissue analysis to confirm it. How much of a problem is that?
That's a valid point. I mean, a definitive diagnosis based on tissue is always the gold standard.
Yeah.
But in a lot of cases, it's just not feasible to do a biopsy, especially when you're dealing with the brain.
Yeah, that makes sense.
So we have to rely on things like clinical signs and imaging and other tests to come up with the best diagnosis we can.
Right.
And in those situations, the presence of midline shift on the MRI becomes even more important as a prognostic indicator.
It basically becomes a really critical piece of the puzzle.
Exactly. It helps us get a clear understanding of what's going on and what we can expect to happen.
Now, the study mentioned that the dogs got a variety of treatments depending on their diagnosis. Did the researchers look at whether the treatment they got affected how long they survived?
They didn't specifically analyze the impact of different treatments on survival time, but they did say that the presence or absence of midline shift often plays a big role in what treatment vets choose.
So even though they didn't directly study it, it's probably safe to assume that midline shift affects those treatment decisions.
It's definitely a reasonable assumption.
Okay.
Vets look at a whole bunch of factors when they're deciding on a treatment plan, and midline shift would be one of them for sure, especially given how it can affect the prognosis.
So the study also talked about some other things that were seen in some of the dogs, like brain swelling or herniation or enlarged ventricles. Did they find a connection between those and survival time?
You know, it's interesting they saw those things in some dogs,
Okay.
but when they did the statistical analysis, there wasn't a significant link to survival time.
So midline shift was really the one that stood out.
Yeah, that's really the key takeaway from this data, at least. It just goes to show how important it is to pay attention to midline shift when you're trying to figure out a dog's prognosis.
This research really opens up some interesting possibilities for future studies.
Absolutely. I mean, there are so many questions that still need to be answered. Like, maybe future studies could look at whether some breeds are more prone to developing midline shift.
That's interesting.
Yeah, they mentioned that certain breeds were more common in their sample, but they need to do more research to know for sure.
Yeah, that would be really helpful information for breeders and dog owners.
For sure. It could help identify dogs that are at higher risk and maybe even intervene earlier.
And what about quality of life? Did the study look at how midline shift might affect that?
The study mainly focused on survival time, but they did mention that some dogs were euthanized because their prognosis was so poor.
Yeah.
So it definitely suggests that quality of life is a major factor in these cases.
It's a good reminder that it's not just about how long a dog lives, but also how well they're living.
Yeah, it's a tough balance. You know, you want to provide the best care possible, but you also want to make sure the dog is comfortable.
This research gives us a much better understanding of these complex situations.
It does. It gives us a deeper understanding of midline shift and what it means so we can make more informed decisions and really advocate for the best care for our patients.
Yeah, it really shows how much we're still learning about veterinary neurology and how research like this is helping us get a better understanding.
Absolutely. And it shows just how important it is for researchers and vets and dog owners to work together, you know, to really move things forward in this field.
So the study focused on dogs, but I'm curious, is this something that's seen in humans too? Is midline shift relevant in human medicine?
Oh, yeah. Definitely, midline shift is something that we see in human neurology as well. It's common in things like traumatic brain injuries, strokes, and brain tumors.
So it sounds like the basic principles are the same even across different species.
Yeah, exactly. The brain is a very delicate organ, and any major shift in its structure is going to have a big impact no matter what species you're talking about.
This study really highlights the importance of using advanced imaging like MRI in both human and veterinary medicine.
Yeah, for sure. MRI gives us such a detailed view of the brain and allows us to see really subtle things that we might otherwise miss.
And we're talking about structural brain disease.
Yeah.
Being able to spot midline shift can really change how we approach prognosis and treatment.
Absolutely. It's such a crucial piece of information that helps us make the best decisions for our patients.
So as we wrap up this deep dive, what are some of the key takeaways that you would want our listeners to remember?
Well, I think the most important thing is that midline shift, when it's seen on an MRI, is a really important indicator of how things are going to go for a dog with structural brain disease.
It's definitely something that vets and owners should be aware of.
Absolutely. It's something that needs to be taken seriously and considered when making treatment decisions.
And early detection is key. So if you notice any neurological signs in your dog, it's really important to talk to your vet as soon as possible.
Right. Always better to be safe than sorry.
Well, this research has given us a lot to think about and a much deeper understanding of midline shift and its implications.
Definitely. And hopefully it will help us all advocate for the best possible care for our dogs.
From Vet NeuroJar, keep those minds-inspired hearts light and tails wagging.